Hi, I'm Dr. Joni Winstead, and today we're going to be talking about the liver. I want to give credit where credit is due. I got this information from Dr. Michael L. Johnson, who started the neurometabolic group that I, along with 400 plus other doctors, are members of. So, back to the liver. Many of us grew up with the Wonder Bread commercial telling us how it helps build strong bodies 12 ways. Well, what that commercial failed to tell us is that Americans have been consuming enriched or fortified white flour since the 1940s, and it is slowly killing us. Now, the problem is that white flour is enriched or fortified with rock forms of iron. Yes, that's correct. They literally take iron ore, pulverize it, and add it to the white flour. Yes, it's true. Iron is vital to make a substance in your body called tyrosine, but over time, rock iron accumulation signals the liver not to absorb more iron, so it can't make tyrosine. And we need tyrosine to make the thyroid hormone thyroxine, aka T4, and adrenaline. Now, one of the functions of adrenaline is holding magnesium in the blood. Now, what is magnesium important for? Proper bone formation, maintaining normal muscle function, releasing energy from muscle storage, regulating body temperature, proper absorption of calcium. Those are some of the things. Now, since the adrenaline can't be made because of the rock iron accumulation causing a lack of tyrosine, many patients suffer from magnesium deficiencies. They find themselves supplementing with magnesium supplements, but they never address the cause. Low adrenaline levels due to decreased tyrosine levels. Okay? Now back to the liver. Anytime I see a patient suffering from hormone problems, male or female, whether increased or decreased hormones, an iron problem, which is including serum iron, ferritin, transferrin, and or TIBC, a problem with red blood cells, or a B vitamin, especially B12 and folic acid, I immediately start thinking that the patient is suffering from a liver disorder. The liver is the cause. Now think for a minute about the functions of the liver. The liver is important for bowel production and excretion of bilirubin, cholesterol, hormones, and drugs, metabolism of fats, proteins, and carbohydrates, enzyme activation, storage of glycogen, vitamins, and minerals, synthesis of plasma proteins such as albumin and clotting factors, blood detoxification, and purification. Now, can you see why the liver is such a major player in our health? The main reasons why many doctors fail to address liver disorders is that the lab ranges of the liver enzymes and other tests are very broad. The liver enzymes are normally contained in the cell, and if the liver is injured or damaged, the liver cell spills the enzymes to the blood. The lab range for the liver enzyme ALT or SGPT and AST, SGOT are 10 to 14. And I have seen some labs go as high as 10 to 60, while the functional or optimal range is 10 to 26. Now, a patient can have an ALT range of 35 and an AST reading of 37, and their physician will tell them that their liver function is normal. But no, it's not, and it needs to be addressed for them to regain their health. Many doctors are addressing thyroid patients, but they are not addressing the patient's liver issues, and this is flat out wrong. The liver plays a major role in thyroid function because 60% of T4 is converted to T3 in the liver. The other 20% of T4 is converted to T3 in the stomach, yet another reason why you need optimal amount of stomach acid, and finally 20% in the periphery. The T4 to T3 conversion is also dependent on zinc. Should thyroid patients gobble down handfuls of zinc supplements? No. And I strongly feel that patients should get trace minerals from their diet. Beef, lamb, veal, crab, shrimp, scallops, turkey, pumpkin, sesame, and squash seeds, oysters, peanuts, yogurt, all contain good levels of zinc. Low levels of selenium can cause inactivity of T3, and this is also not good for a thyroid patient. Tuna, cod, halibut, sardines, shrimp, salmon, beef, turkey, and lamb all contain high levels of selenium. So in order for T3 to be accepted by cells, it needs calcium, magnesium, and trace minerals. This is why it is vital to have sufficient mineral absorption and your pH between 6.4 and 7.0. And I have done a video on pH for you to listen to. And homocysteine, it's an amino acid that can be generated in response to toxic or nutritionally deficient diet. When homocysteine is increased in the blood, it is linked to massive inflammation and neurodegeneration. In Alzheimer's disease and many other chronic diseases, we find significant increase in homocysteine in a blood test. The metabolic breakdown components of homocysteine alter the NMDA receptor sites, leading to multiple negative effects, including free radicals and massive inflammatory cascade. These free radicals and inflammation can trigger an autoimmune response in which the patient's immune system attacks the thyroid gland and/or body systems. Free radical excitotoxins, inflammation can all be successfully addressed via diet and using proper supplementation. Liver and inflammation problems in the body can be addressed successfully using natural protocols. We have the system for that. We have the supplements. We have the protocols. So if you are interested in any more information about this, and if you would like to have your liver checked or have your blood checked so we can see if you have these problems, email me at drjoniwinstead@gmail.com. Ask us for more information and we'll be happy to send it to you. Thank you.